Yes, I think we are. We have a very good health service, and we've done it before, and kids are vaccinated all the time with other vaccines. So there should be no problem at all to roll out the vaccines for the children. I think what's important for the Ministry of Health to do just now, after they decide, to roll out the vaccines, is really to come out with all the answers that parents are worried about. I think parents, and it's okay for parents to be worried about vaccinating their children, especially with something new, and we really will be one of the first countries to do that in the world. So I can understand parents that are really worried and want answers, and I think the Ministry of Health just has to listen to the parents and try and give as many answers as they can. I know that we don't have answers to everything, but when we weigh the risks, I think it's all for the vaccines for children. And we have to understand that even though the fourth wave is, on the way out, but we will have another wave. And if children are vaccinated, that may put off the fifth wave or just make it, lower. So I think it is a good idea to have kids vaccinated now, but really we have to listen to parents and hear what their concerns are and try and answer them and try and find the data to answer them, because we don't always have all the data for all the questions they have. So we have to work on that, and collect the data and then really be transparent and give it out to parents.
It sounds like you're encouraged from the roughly 50% response. In other words, it's an opportunity here. There's a bulk of parents that are open to it, but needs to be a more concerted public information campaign. Is this where you'd expect the Israeli public to be at this point, about 50% on this issue? Again, given this is new territory for children.
Yes, I think so. Parents who are not vaccinated, I'm sure, will not vaccinate their children. So, that's a group of people who I think will be very difficult to convince to vaccinate their children. Actually, from that point of view, they are at the highest risk because the children bring it back from school. And if they're not vaccinated and the parents are not vaccinated, then obviously there's a very high risk of having another outbreak, especially in this group of people who are not vaccinated. But I think most of the ministries of health work should be done with the parents who are vaccinated, who are willing to vaccinate it, but are worried. And so let's answer their questions, and convince them that it's okay to vaccinate their children.
And on the importance of this vaccinating this young batch of kids, once they are vaccinated, the 5 to 11-year-olds, you mentioned this a bit earlier, barring any emergence of other variants, does this essentially mark the end of the current wave of the pandemic that we're in?
Well, the fourth wave is coming to an end. That's obvious. But we really don't know. Now the skies are opening. People are traveling, coming back. They're even talking about tourists beginning to come back to Israel. And obviously, the rest of the world or the rest of the developing world is not vaccinated. So as long as there are a very large percent of people in the world not vaccinated, we will be having more variants. There's no way around it. The only way to get around it is having the whole world vaccinated. And that's going to take a long time still. We're far from that. So variants are going to be around all the time. So obviously, there are going to be new waves. I expect another wave in the winter together with the flu. That's going to be much more difficult. So I know that everybody's saying that, well, last year there was no flu. But the professionals say that there is going to be flu this year. And together with the corona, that can surely bring a large another wave. So if kids will be vaccinated, that could have a large effect on the prevention of the pandemic.
There you have it. Thank you very much, Dr. Orna Epel, for your time on the program.